Maverick Physical Therapy, welcome to San Diego, California. Maverick Physical Therapy. We have some interesting episodes that are coming your way. A little DDX. DDX, nerd-coded version of our translation, differential diagnosis. To be a good diagnostician, a diagnoser, there's a lot that plays into that in terms of today being a physical therapist and applied functional scientist. We're going to go through some interesting kind of stories and give you all some perspective in terms of if you need help someday, some quick, simple things that clinicians are looking for that can provide good sparking and direction of conversation for individuals to be able to pick things apart. We're going to give you a little strategy in terms of what's used today by clinicians, from everyone from a medical doctor, physician's assistant, and a physical therapist, and how you can be under the best hands, the best ears, the best voices that can engage in this dialogue with you. We also, thank goodness, for a few individuals that are willing to allow us to share their stories with you in the form of some case studies. So we're not violating HIPAA, but it's a rarity that someone will kind of put themselves out there and make themselves very vulnerable to enable you to know their medical history and the situation, the story of what they went through, especially the individuals that we're going to see. This is some very, very unique stuff. So DDX, differential diagnosis, a diagnosticator, a diagnostician. Myself personally, to kind of get us going and find some connection in this, I want to share with you a story that I hope will connect us and that gets us kind of to the point of, in terms of what and why I do what I do. And kind of connects the dots in terms of sharing a little of my fun and excitement and joy, passion with what I do in terms of working with people and getting them better. So I grew up in the state of Michigan on my parents' farms. My grandfather, Grandpa Friends, he started and originated the farm. My grandpa, on the other side of things, of the family, he owned a boat marina and recreational vehicle mechanic shop. So between selling outboard engines, Mariner, Mercury, Johnson, Evan Rude, your pontoon boats, to being at the time when he turned his Polaris dealership over in the early 2000s, he had been one of the longest Polaris dealers ever, dating back to almost when they originally started, around I think 50 years or so. So snowmobiles, personal watercrafts, ATVs, your four-wheelers, etc., and also lawnmowers. So when I think of diagnosticians, I think of my days back on the farm with my father and my grandfather. So shipped out to Michigan for my little guys, one of my old Ford tractors and wagons right here. Brings me back to the old farm days. My little guys Maverick and Maddox, play around with these guys now. Really cool thing to see them play, and really rejuvenates and refreshes all these stories and gives me a lot of good reflection all the time. Really cool. But on the farm, although they weren't super great mechanics by any means, there was some great people that they have in town that take care of those needs. There were certain things at a point in time, though, that you had to do based on the terrain that you were in. If you're stuck out in the middle of some orchard and you had a breakdown, or in a field, you're disc upon, etc. Some really rough and interesting conditions and terrain for anybody to be able to get into. So being able to do some on-the-go troubleshooting to rule things in and rule things out, to potentially maybe be able to get a part for yourself and do the work yourself. Not only could you save some money on the expense of the labor and just being able to get out into the field, you really being able to care for equipment properly and preparing them equipment properly for the seasons and the vigorous terrain and conditions that they'd be going through is very, very key. So you had to be able to do some creative kind of predicting, kind of troubleshooting, some anticipation, and you had to be able to do some test driving, etc., to be able to see, feel, and know if things were dialed in the way that they should be. So I was able to glean a lot from that, but I would say a bigger aspect in which I was able to glean from was spending countless hours down at my grandfather's shop, good old Southside Marine, and watching my grandfather and his workers go after opening up these all-terrain vehicles from hood to bumper, bumper to bumper, and being in the situation behind the countertop, listening to my grandfather engage in this really unique dialogue with the owners that came in. I'm sure a lot of times they're like, just fix my stuff, why are you asking me these questions? But what was actually taking place and happening between asking questions such as, hey, when was your last tune-up? How did you store this thing? So if it's snowmobile, how do you store it throughout the spring, the summer, and the fall? Where did you store it? Who was driving it? And if it was in season, who was driving it? What were you doing? What were you doing with regards to preparation? What kind of symptoms was it presenting with? And when? When was it doing this? And hey, was there anything that you were doing, or at a certain speed, do you notice nothing happening that is completely normal? And so over the years, having a grandfather that had owned this business, he's 92, because of health issues, still not able to be there full time every day up until a year or two ago. But from the age of early 90s through 30s and 40s, running this business and this line of work really gave me a lot more perspective than what I could have ever imagined with regards to mechanics and parts of vehicles and engines, and transferring or translating that into human beings. We still have this kinetic chain, force producing system that is linked together as a unit. And what my grandfather was doing was saying, hey, when did this happen? A, is there some form of event? When is it worse? When is it better? Or what makes it better? So really, really key elements. I feel like I was really blessed to be able to glean from at a very, very young age. Although he didn't use those words, his questions were always simple, to the point, and alluded to all of those four little things right there. As a clinician today, and being in the medical world, and as a patient that has been treated by physicians and others in the medical world, it's really important to realize and understand that you provide the answers. You're probably thinking right now, what in the world? I go to see someone else, like a clinician, someone has a degree, spends hundreds of thousands of dollars to dig into this stuff. I don't have the answers, but yes, you do. What we also need to realize today is that the healthcare world and field is in this this unique compaction in which it's never been before. You're having physicians and clinicians that have their heads stuck in a computer for maybe 5 or 10 minutes until they say, okay, you're good to go, give you medication, or no, there's nothing wrong, or this is wrong, okay, see you later. They're on to the next patient. So with regards to getting the care, the customized, the individual care that you need, or that a patient needs, it's really rare unless you have someone that can do a great, phenomenal job of multitasking and know the ins and outs of the insurance game. And so ultimately, first and foremost, we need to look out for the patient, and we need to play the game that the insurance needs to be played there with regards to all the assessments and the tests that are irrelevant to the state, the patient's state that they're currently in, and a lot of times don't give us a lot of information with regards to the rehab diagnosis, but more importantly, the root of the problem. So first and foremost, as a physical therapist, and you can reference back to one of our episodes in regards to the physical therapist who has his doctorate today, and what its job and what their job and responsibilities are, and what its job as a body today is. In that, we need to first and foremost, every time I work with a patient, whether they come into my clinic or whoever I'm seeing, first and foremost, I need to make sure that you're within my scope of practice to treat. Okay, well, what does that mean? Well, it means that when you're seen by a medical doctor, orthopedic surgeon, a lot of ortho specialists, you're going to be giving a medical diagnosis that is coded for billing purposes, very non-specific thing. And when I get my references and get individuals that have been told, hey, this is what you have, I often say, don't tell me. I don't need to know. I'm going to run my evaluation. First of all, I don't need to be biased towards anything that you have going on. And B, what you have been told that you have is extremely bootleg and doesn't have really much of anything to do with the rehab diagnosis. Besides that, it's some anatomical, non-specific location of some form of injury, of some pathological state that's in the musculoskeletal base or neuromuscular base area of treatment, in which that's why you're seeing me. So, translated, lumbago, short term for low back pain. You have a million different impairments in the low back or in the lumbar spine region, and gobs more, infinite times more in terms of the root of the problem and why you have that low back pain, which is coded as lumbago. Cervicalgia, neck pain, same thing. Rotator cuff syndrome, okay, so I've got some shoulder pain. I've got 4 rotator cuff muscles, not very specific at all. So with regards to our DDX, differential diagnosis, being a diagnostician, a diagnosticator, and being a master Yoda ninja of that, I need to know, first and foremost, if I've only been given 4 questions to ask you and only have 5 minutes, because really, movement, that's where it's going to show everything. I need to know, and the red flags, if I can't get responses from the patient, what was the mechanism of injury? Do you know a specific time or an event in which this occurred? If no, red flag. B, what makes your symptoms worse with movement or no movement? Can't answer the question, red flag. What makes it better? So alleviating factors, nothing, red flag. When is it better and when is it worse? Inconsistencies with all those get me hypothesizing as a clinician that you're not within my scope of practice, and I'm going to move you, and I'm going to move you like nobody before me has ever moved you, and how not many people on the face of this planet can move you, and prove to me that you don't have what I think that you have. Because a good clinician, within 5 or 10 minutes of dialogue and discussion with you, the patient, has to form hypotheses in terms of what they think it is. It doesn't mean that we have to stick to those. It means we have to have a little bit of a thought process already rolling before we get into this movement-based process. And back to the point at which I made earlier in regards to you, the patient, provide us the information. As a clinician, we need to be able to be brief with our questions and be patient with our listening, with big fat ears sucking that in which we're not asking a patient and pushing them out to kind of walk the plank, so to speak, teeing them up, so to speak, so we can mash it. Shame on us if we are starting to jumble up a patient and crumble them up with some form of rehab diagnosis in which, or of something that we typically see based on an anatomical location and that the patient is telling us. Shame on us for that. Episode 2 coming on up.